transplant means the difference between life and death. I want you to meet Dr. Evan Kransdorf. He is a Mayo Clinic cardiologist who treats patients with advanced heart disease. And with him this morning, very exciting, a recipient of a heart is David Wiprack. Good morning. Thank you. Welcome to both of you.
Thank you.
And first of all, it's so exciting, David, because I've never met really anybody who's been the recipient of a heart transplant, so I cannot wait for our viewers to hear your story. But Dr. Kransdorf, I want to start with you. At what point, and I know that you treat patients, you're not the surgeon, but you are working with patients prior to deciding, when do you actually decide that a heart transplant is necessary?
That's a great question. So for most patients with heart failure and a reduced squeezing function, medications and in some cases devices are effective in managing the symptoms and also in stabilizing the heart function. But some patients do progress and are not responding to medications, and they develop end-stage heart failure. And for these patients, that's when we start thinking about heart transplantation.
Now, I look at David, and David's 38 years old. What was David's condition that required him to have a heart transplant?
Yeah, so about half the people that need a heart transplant have that due to what we call dilated cardiomyopathy, where we don't have a clear explanation. In David's case, it may have been a virus that caused his heart to fail.
Okay, all right, David, I want to know at what point, and I know this is something that came on rather suddenly for you. You're a Phoenix firefighter.
Yes.
And tell me about some of the symptoms that you were having back when this whole thing started.
Yeah, it started around the holidays. I started having a short cough, and then I went into the new year with difficulty breathing. Went to several doctors. They diagnosed it as pneumonia. Because of the x-rays they kept taking of my lungs, they see fluid in the lungs and around my heart. With that said, I was on medicine to the point where it wasn't working.
Yeah.
Then I got to the point where I had to check myself in.
Wow.
To a hospital.
So, and I know this all started at another facility, and you ended up at Mayo Clinic, which,
yes,
by the way, Dr. Kransdorf is the only clinic in the Valley that does heart transplants.
Correct.
I want to know, what went through your mind when the doctor came in and said to you, you're going to need a heart transplant?
Oh, I was in denial.
Yeah. I
was in denial. I figured I could beat it, take medicine, get better. I was always healthy. I had pneumonia when I was a little kid. I thought I could beat it.
Yeah.
Then it turned into a misdiagnosis.
Wow.
It wasn't pneumonia. It was heart failure.
Heart failure.
So.
And you're just 3 months post-op.
Yeah.
That's amazing.
Yeah.
That is amazing. Dr. Kransdorf, I know this procedure is a very lengthy and involved one, and we have a diagram to show that with technology today, it has become so much, I don't want to say easier, but how would you describe what you guys do and you're able to provide this new technology to patients like David at such a young age?
Sure. Well, the first part is when the patient is deemed to have end-stage heart failure, they're placed on a waiting list, and when a donor that's compatible for the recipient becomes available, then the surgery is performed. The surgery is performed basically by taking out the old diseased heart and implanting the new donor heart into the recipient.
That is truly amazing, and I know that you know, we're grateful that you're here, and we're grateful for the technology that Mayo Clinic has brought to the Valley. And just very quickly, David, if you could speak to people at home, how important is it to become an organ donor?
I'm living proof. I'm here, and at my age, I'm still living. I plan to go back to work, to being a firefighter again. I could still raise my family, so it's really important.
Yeah.
And to me, it was a gift, and I want to share it with everybody and promote it.
Excellent. Thank you to both of you. Truly an amazing story, and I know that you're going to continue to do amazing things. And Dr. Kransdorf, thank you for sharing all of the new technology and what Mayo Clinic brings right here to the Valley. If you'd like more information about Mayo Clinic and you'd like to make an appointment with a cardiologist, here's the number to call, 480-301-8200. And to learn more about organ donation, go to donatelifeaz.org. And don't forget, ABC 15 is teaming up with Mayo Clinic for the Rally for Red campaign each month We'll give you easy to follow recipes and ideas to help keep you and your loved one's heart healthy. To learn more and get our Rally for Red reminders, sign up at abc15.com/rallyforred.